Good afternoon.
Oh, I'm sorry. I was calling on that young lady right there. But I'll call on you afterwards. I just didn't want to. Go ahead.
Hi, my name is Elmira. You had spoken about the health care, making it universal for everyone, right? Well, as a single parent with a child that has autism, having a difficult time, of course, being so that I'm not exactly very low income, but I'm not middle class. I fall in that bracket where I don't get the sources that he needs. Of course, I'm paying out of pocket a whole lot, and I'm also not getting the services within the city. I have to go out the city. What are you gonna do for my son's future?
Well, the first thing is my general counsel has an autistic son. One of my best friends in Chicago has an autistic daughter, and I know, how fiercely you love your child, but I also know how hard it is, how much work it is for you, and how much support you need. So one of the first things I want us to do is to find out why is it that we're seeing increased incidence of autism. We've got to put a lot more money into research and the science behind autism, because the rates are skyrocketing, and nobody has pinpointed exactly why, but it is reaching epidemic proportions here in the United States, and it's something that I want to devote serious research dollars to dealing with. So that's point number one. Point number two, for parents who already have autism, whose children have already been diagnosed with autism, we're going to have to give you more support, which means that, and the support comes in two ways. Some of it is on the healthcare front, because they may have special needs, and this would be comprehensive coverage. So your son wouldn't be excluded for a pre-existing condition in terms of getting the treatments that he needs. But a lot of it is also the schools, right? Because what we need is early diagnosis can make a big difference in terms of how your son or anybody with autism ends up adapting. The earlier it's diagnosed, the more frequent their therapies, the better their outcomes oftentimes. So what I want to do is make sure that we've got effective screening in every public school, and that as part of the special education mandate and program that exists in every school district, that autism and care for autistic kids and therapy and all the work that's required, that is part of every school district's mandate, the requirement that they provided, and the federal government has to provide the funding needed for special education, something that it has never done. We've always promised at the federal level that we'd provide 40% of special education funding, but the most it's ever been is 18%. And what I've said is we're going to start fully funding special education the way that it was originally intended. But I know how difficult things are right now, and so I will. And there's a number of organizations of parents of autistic kids who've started to get mobilized and organized in Washington, and they're starting to get a voice, and I look forward to working with those organizations. Okay, gentleman ready. Last question. Gentleman ready.
Good afternoon. Mr. Arun, it's a question of the international student regarding immigration policy. Like a lot of international students are coming in the United States, and after completing their education as masters or different disciplines, they are given an OD status for 1 year only to get their visa and H-1B category. But as such, this country is going into recession. There are very few opportunities the student get to convert their status to H-1B. Now, if we can think on immigration, if after passing from the college, if the student can be given H-1B categories for a period of some time, so you will not waste the talent which has been developed in this country to going outside.
Well, I think that it is very important for us to try to encourage the best and the brightest from around the world to stay in the United States, invest in the United States, develop companies here in the United States. That's been part of the tradition that has made the U.S. economy so strong. It is also important for us to make sure that we are developing talent here in the United States that can succeed in many of these areas as well. So I think it's a balance. There are some occupations where the truth is the only reason that we need an immigrant workforce is because we're not doing what we should be doing here in the United States. And I'll give you a very specific example, nurses. We constantly have a nursing shortage. That's not because there aren't enough U.S. workers who could train to become effective nurses. The problem is that nurses are not paid enough, and we don't pay nursing professors enough. And so what happens is the supply of nurses dries up here in the United States. And what we should be doing is improving pay for nurses, improving working conditions for nurses, paying nursing professors more money so that there are more slots to train nurses. We don't really need an immigrant workforce to provide effective nursing services. On the other hand, if somebody has a master's degree in computer science, we need to produce more computer scientists, but the supply, we can always use more people who've got advanced degrees and who might create innovation and create new products. And we should examine how can we encourage some of those people to stay here, because it used to be that they had no choice but to stay here and work. Now, with India doing well, with China doing well, with the European Union doing well, Eastern Europe, people don't have to come to America for opportunity. They can stay in their home countries. They can go back to their home countries and be very successful. And so we've got to make sure that we're balancing our concerns about developing the U.S. workforce with understanding that we thrive as an economy when we have the best and the brightest from all around the world studying here and eventually putting down roots here, starting companies here, creating economic growth here. That's good for America.